All right, if you're a new direct support professional, this one's for you. We're going to talk about one of your most critical responsibilities, helping people with their medication safely. So let's dive right in.
So, why is this such a big deal? Well, to get some perspective, just look at this number. When people in the US don't take their medication the way they're supposed to, it costs over $100 billion a year. That's a staggering amount, and it comes from things like extra hospital visits, lost work, and tragically, even lives lost. The work you do, it directly helps prevent that.
Now, this quote is pretty blunt, isn't it? A very high-risk activity. Look, that's not meant to scare you. It's meant to show you just how incredibly important your role is. The skills we're about to cover are all designed to help you manage that risk and, most importantly, keep the people you support safe.
Okay, so let's start by really defining what your role is here. You're not just a person who hands someone a pill. No, you're a key part of their entire well-being. You are literally the barrier that stands between them and potential harm.
As a DSP, you're working under some very specific rules. And here's the big one you have to remember. You can only assist with medications that have been ordered by a licensed professional. That goes for everything, from really strong prescription drugs all the way to something simple like Tylenol you can buy at the store. If a doctor didn't order it, you can't touch it. Simple as that.
So, before you can help anyone, you have to know exactly what you're looking at. And the medication label, that is your #1 source of truth. Honestly, learning how to read it inside and out is one of the most fundamental skills you'll have.
You're generally going to come across 3 main types of medication. Prescription meds, pretty straightforward. Then you have over-the-counter, or OTC. Now, even though anyone can buy them, in a care setting like yours, you still need a doctor's order. And finally, PRN. That's just a fancy Latin term for as needed. These are for specific things, like a headache, and they also need a doctor's order that says exactly when and why they can be used.
This right here, this is what it's all about. The pharmacy label. Everything you need to know to keep someone safe is printed right on it. Your job is to know exactly where to find each piece of information and what it all means. So let's break it down.
These are the heavy hitters. You have to check every single one of these every single time. The person's name, the drug name, and how strong it is. The exact dose, how and when to take it. You can't skip a single one. Each one is a critical safety check.
Okay, now we're getting to the absolute heart of medication safety. This next part covers a protocol that has to become second nature for you. It's the system you'll rely on every single time you assist with medication.
And the magic number is 7. There are 7 non-negotiable rights. Think of these as the unbreakable rules of the game. They form the bedrock of everything you do when it comes to safe medication assistance.
And here they are. The right person, right medication, right dose, right time, right route, right reason, and right documentation. Let's quickly walk through what each of these really means when you're on the job.
First up, the right person. I know, it sounds so simple, right? But mistakes can and do happen. You have to use at least 2 ways to identify them. Ask them their name, check it against the label, and then use a second check, like a photo on their medication administration record, or MAR. Next, is it the right medication? This is huge. You have to read the name on the container and match it exactly to what's written on their MAR. No guessing, no assuming because the pill looks familiar. It has to be an exact match.
Third, the right dose. Exactly how much are they supposed to take? Is it 1 pill or 2, 5 milliliters or 10? The dose on that label must match the MAR perfectly. And hey, if you suddenly see someone is supposed to get 3 pills for a dose when it's always been 1, that's a red flag. You need to stop and ask questions. Number 4 is the right time. You know, medications are scheduled for specific times for a reason. That's how they work best and safest. Is this a morning medication, a bedtime one, every 6 hours? Following that schedule is absolutely crucial. Fifth, we have the right route. This is all about how the medication is taken. Is it supposed to be swallowed, rubbed on the skin? Is it eye drops? The route isn't a suggestion. You have to follow it exactly as the doctor prescribed.
And number 6, the right reason. You should always know why someone is taking a medication. This is especially critical for those as-needed or PRN meds. For example, if the order says Tylenol is for a headache, you can't just give it for a sore leg. The reason has to match the doctor's order.
And finally, the 7th right. Listen, the job is not done until you've documented it. That means you put your initials on the MAR immediately after the person takes their medication. Because if you don't write it down legally and for safety, it never happened.
So you know the 7 rights now. Great. But how do you actually make sure you follow them every time, especially when things get busy? Well, you use a really simple but powerful method called the 3 checks. This system puts those 7 rights into action. You're going to check the medication label against the MAR at 3 very specific times. First, when you pull the medication out of its locked storage. Second, as you are actually preparing the dose, popping it out of the package or pouring it. And third, one last time right before you hand it to the person. 3 checks, every single time, no exceptions. All right, let's really zero in on that final critical step. Because what you do after the medication is taken is just as important as everything you do before.
This document you see here, the Medication Administration Record, the MAR, this is your command center. It's the official legal record of every single dose. It's what you use for your 3 checks, and it's where you finalize the entire process. And you absolutely must document immediately. Why? Well, think about it. It prevents your coworker on the next shift from making a terrible mistake and giving a second dose. It creates a rock-solid legal record. It tracks if a dose was taken or refused. And maybe most importantly, it's how you communicate clearly with the rest of the care team. Waiting to document is just asking for trouble.
So here's the bottom line. The 7 rights and the 3 checks aren't just a bunch of rules to memorize. They are your tools. They are your guide to making sure everyone stays safe and gets the best care possible. They empower you to handle this high-risk task with skill and confidence. So the only question left is, are you ready to make them a part of everything you do?